So just to summarize the technique and treatment stations, the ones that I have shown you today is how to perform it. Now that I gave you the indications of how to use it, when to use it, if they give you a stem, you should know when to use it. For example, they're gonna be like, the patient came in with a lower back problem, with fascial restrictions in the lower back, a dull local pain in rhomboids, and a scar tissue on supraspinatus muscle. Treat accordingly. That's the gist of how they might ask you that. So follow the order. What should you do first? Fascia. Where did they say you're gonna do it? Lower back. So it means you're gonna do your fascial technique in the lower back. Yeah? Then they said there's a local dull pain in rhomboids. That sounds like a pressure point or a trigger point. So maybe you should do your trigger point technique on rhomboids. Then they said that the patient has a scar tissue on supraspinatus, meaning to say you're gonna doing friction technique in the supraspinatus. So they're gonna be a little like, based on what the handbook is saying, it seems to be that they're gonna lead you to what they're looking for. That's actually one mindset that I want you to embody when you are in OSCE. Every station you go in, you need to understand what are they looking for so that you're not overthinking. And everything on the stem is provided because it's what is said in the Prometric handbook. They did not give that for a reason. I'm not saying this because I've heard people say it or this and that. I don't have anyone inside the CMTO. It's not like that, right? It's just that these tests are created with an instructional design. It is made to test something. That's why they're not gonna give the criteria if they don't know what to check. So again, when you go in technique station, think about, number one, what are they testing for? They're testing for technique. So if they say you don't need principles of massage, you don't need hydrotherapy, they tell you do beating tapotement on rhomboids, do this and that, do just that because that's the instruction, right? But if you go to treatment and they give you a case scenario, you know that when you're getting inside that station, you know that they're not asking you only if you know the techniques. They're asking if you know when to use it and how to use it in your time management. And can you create a safe and effective treatment for the client? Right? So that removes the stress in you actually because you know what you're getting into. Right?
Yeah.
So any questions for technique and treatment?
Is it bad if I'm done super early in a station?
I mean, it's good if you finished a little bit early because it means it gives you time to review what you have done. That's why being organized is also another way to actually ensure that did you do everything correctly? Like, did you miss something? Did you misread anything, right? They will respond. The people are gonna, the demos, they're gonna respond according to what you do. So that's why I kind of told you earlier that doesn't matter what your teacher taught, teacher A taught you, teacher B taught you, what I taught you. If you have multiple versions of it, that's great because maybe this person doesn't react to versions A and B, but maybe version C, they're gonna react because it's the same core, just different method, right?
Yeah.
So at least it gives you a little bit of stability there. Okay, so I remember this person didn't react well when I did the version A of trigger point. Maybe let me try that again. So when you finish early, try to correct things that you can correct. And then from there, see, right? If you finish late and you did not finish the station, remember, you cannot control things that you can't control, right? So that's why my suggestion all the time is if you know how to do it in a very organized manner, like step 1 to step 2, then step 3, and you can time manage it properly, you can count that as a good point, you know, like you can count that as they're probably gonna grade me something on that, right? Rather than doing everything quickly, but then you didn't do the technique properly. You didn't embody what they were looking for. But what if you did most of the techniques correct, but you forgot a few steps towards the end because you run out of time? That's still better rather than rushing and then missing a lot. So that's why time management is important for the scenario stations. You need to watch your time. Yeah? That's my general gist for technique and treatment, and also making sure that you ask your client. Your client knows what they feel like, right? Don't assume things. Ask them. So for example, I'm doing a warm-up and I know that in this area should be trigger point. So instead of saying, I'm going to do the trigger point on rhomboids now, because in treatment, you're not going to do that. So what you can say, okay, so while I'm warming up here, I noticed that there's a knot, so I'm going to treat it using a trigger point technique. It's going to be a bit painful, but I'm going to work within your tolerance. So while I'm warming it up as I speak, I'm going to give you a pain scale of 1 to 10, 1 least painful, 10 most painful, 7 tolerable pain. Once I find the knot after this warm-up, I'm going to press it and you will let me know if it's 7, and then we're going to wait until it's down. So did I explain it to you like a regular client? Yeah, because that's how I'm going to explain it to a patient who doesn't know what I'm going to do. Right? But instead of like, I'm going to start with trigger point treatment now, John. And John, this is a very painful, like it's too much time. But see, while I'm talking, I'm doing palmar stripping in the area because I wanted to make sure that I got everything covered. Yeah? So if you need to explain, because me explaining in that way is safety for me. And I'm not wasting time because I'm literally I'm warming up as I explain it to him. And you telling that to the client indicates to the examiner that this is it. Some people keep saying you don't have to say it, they just know, so on and so forth. There are other tutors out there or other instructors that would say, oh, you have to explain it. Then the other person is, you don't have to explain it. Then the other person is, so on and so forth. But if you're asking me that specific question, for me, explaining it that way is for safety. Because I'm just letting him know that he's going to get, John here is going to feel something that's a little bit out of the norm. And I'm giving him instructions about what's to go next. That's safety. But if I started explaining the theory of and the history of trigger point and literally how I'm going to put oil in my hand and how I'm going to dig my thumbs on the trigger point is extra. That's talking too much. That's why I said it's not like do more, talk less, but it's like do more, talk enough kind of situation. Right? If you feel that you can do the technique with safely without explaining it to them, sure. But make sure your techniques are spot on. That's why I said if that's what they think it is, go ahead. But me, I want to explain the instructions, not the meaning, the instructions of what's supposed to happen. And I don't know if you noticed, I don't explain every instruction. I didn't even tell him about the stretch at the end. I reminded them, okay, since I feel that it's gone, let me just stretch. Okay, do you feel? Yeah, I didn't even say about the flush. Because I don't have to say it. Like, they can see it. But I gave them the instruction. I'm letting them know that I'm almost done. It's just acknowledging what's going to happen and not going to happen kind of thing. You can say the purpose of the technique, but not in the theoretical sense. Like, oh, I found here a knot, which is probably causing your pain. So I'm going to treat it. I gave the purpose, right?
Yeah.
I gave the purpose. So I believe that you have like a dull local pain here. So it might be a trigger point. Oh, that's a purpose. Right? Oh, I believe that you have, you mentioned in the thing, you mentioned that you have some restrictions on the lower back. So with this, I'm going to treat it with. So you mentioned the thing, the purpose. You don't have to be too theoretical about it. Because I think, because again, there's a lot of people debating, you don't have to talk much stuff. Because I have experience where they do tutoring with me and then they go to another tutor or they talk to their instructors or friends. So you don't have to explain, you have to explain, so they get confused. My suggestion is pick what you feel the best is and then from there, apply it.
Yeah.
Worst case scenario is they don't like it, but I don't think it's reasonable for them to deduct points because you have over-explained. I think they're gonna deduct points if you did the technique wrong.
Yeah. Okay.
Right?
Yeah.
That's why I said do more, explain enough. It's probably gonna be over the body. Assume everything. With this type of exam, assume everything. Don't just say, oh, I hope. No, assume everything. Practice for everything. Right? But my suggestion is do what you know that you can do best first. If you're unsure, do it last. But then also try to see, okay, if I can do supraspinatus better, what can I do next that I can do that the stretch is the same, so on and so forth. You have to think about the whole process too. Like, okay, so when I do the stretch for rhomboids, should I turn him over or I can do it in the front? Or, think about think in advance. So if the patient is in prone, like, because when you read the stem outside, you don't know what position they are in. Yeah? You might have a guess, but assume everything. So in that sense, you could be like, okay, if they are in prone, I'm going to do this first, this next, then this next. I don't know this, I'm going to go back to that later. But then if they're in supine, I'm going to do this instead first, and then do this and this next. Right? So at least you have contingency plans. Because for me, the way to pass OSCE is first knowing what you should know. Second, preparing in accordance to how they prepare the exam. So they're very specific, so you have to play around with those. So that's how you play around. Prepare contingencies. Plan A, B, C, D, F, whatever. Don't ask about, do you think they're gonna give it to me? That just assume they might give it to you and then practice for it. It's better if you practice extra than you're like, oh my God, how do I do this?
Yeah.
Right? To be honest, for reading the stem, it's just that I noticed that if you miss a couple of things, if you misread a couple of words, it might lose you time. Not lose. I don't wanna say lose points, because that's more. I mean, we have to face that the exam is really nerve-wracking, but as much as possible, troubleshooting wise, we need to figure out a way to fix problems when it comes up. I think that's the best mindset that you're gonna have in this exam. Prepare as much. I know that you have a couple of days. It's already the 22nd today. You have a couple of days, but still it's a couple of days. I don't think it's really a big issue, because most of these techniques, you just need to keep practicing and then find tweaks. Let me re-summarize what we have done for techniques and treatments. Again, you don't have to keep reintroducing yourself. They know who you are. Techniques is to know whether you know how to perform the technique. So when you're practicing for that, make sure that you're very spot on the steps. And then for treatments, they're testing if you know how to apply that. So you have to understand that you have to be spot on when to use, how to use, so on and so forth. I don't want to invalidate your feelings of overthinking, but there's a tendency that you're definitely gonna do that. So a way to remove the stress is just to make sure that you are organized in performing all of these techniques. You understand when and how to use them, because worst case scenario, that's the only thing that you can bring there is yourself. So if you know all the contingencies, I've showed you multiple versions. Check what you've learned at school and try which ones you're comfortable with. If the client doesn't respond properly, then try the other versions, as it would be a little bit nicer on that end. Again, they're not gonna check body mechanics. They just want the technique. It's never the reason why I would say that is because I've never read it in the thing. I never read it in the book.
Yeah, you're right. It's more about the client, I think.
And the logistics of like, do you know your stuff? Yeah.
Yeah, for sure. All right, thank you so much. That was like really, really good.